Oscar winner Angelina Jolie is turning heads for something other than her acting and directing skills today. She announced she has one of the breast cancer genes, and over the past 3 months, she's been undergoing double mastectomy surgeries. The announcement is bringing genetic testing for breast cancer to light and leaves many women wondering if they should be screened. Erica Edwards has more.
A leading lady in Hollywood, Angelina Jolie has used her star power to promote humanitarian causes.
This violence can be prevented, and it must be confronted.
Now she's taking on another cause, breast health. Writing in the New York Times, Jolie says she underwent a double mastectomy after learning she tested positive for one of the breast cancer genes.
She's in her 30s and she has several children, and she watched her mother die from cancer, and she wants to do the most she can to avoid this.
Genetic mutations cause about 5 to 10% of breast cancers. Getting tested for the genes is the most effective way to determine your risk, but doctors say only people with a strong family history should consider screening.
If it looks like there's a lot of breast and ovarian cancer, particularly in young women in your family, seek the advice of a high-risk clinic. Inquire about the possibility of having a BRCA test done.
While the test is widely available, not every woman can afford the hundreds of dollars in out-of-pocket expenses.
Genetic testing is covered by most insurers in the United States at this time, not ever as completely as one would like. It's still a very expensive test.
So are the treatment options for women who test positive, which include breast and ovary removal surgeries or vigilant monitoring with mammograms and breast MRIs. Neither option is a 100% guarantee, but they do significantly lower the risk for disease. Erica Edwards, NBC News.
Jolie says she feels empowered by her decision. She hopes coming forward with her story will help women make more informed choices about their own health. Jodion Thompson continues our coverage now with how her news is impacting the Kansas City area. Jodion.
Well, Krista, the woman who has been diagnosed with the gene, or the women that is, that have been diagnosed with the gene, want to do everything they can, obviously, to prevent the cancer. This is one of the ways they test it. It's a kit that includes basically a little cup here and a mouthwash. Now, doctors we spoke with today at the University of Kansas Medical Center do want to warn you. They say the patients they test first need to go through a screening process. That way doctors will know the patient's individual and family history, because that can affect the level of risk. If you decide to get tested, it's pretty simple. Like I just mentioned, it's in this kit that basically tests the cells from your cheek. Now, the gene is rare, but if you are diagnosed with it, you can decide if surgery is an option then.
We don't ever make a decision for them. We just help them process that information. And about 30% of women like Angelina would go ahead and have both of their breasts removed.
At 5, we'll have more information from a woman in Lee's Summit who went through a very similar situation as Angelina. You won't want to miss what she has to say about her decision to have a double mastectomy. In the newsroom, Jodion Thompson, 41 Action News.